Hi everyone, welcome to this session on antihistaminic side effects. So you're going to learn about the side effects of antihistaminic in the form of flow charts, which will be easy for understanding. So let's see what are all the side effects which are produced by the first generation antihistaminics. Usually the side effects are frequent, but it is mild and it shows individual variability. And over a period of time, the tolerance develops to the side effects of the first generation antihistaminics. So, what are the CNS effects which we can encounter with the first generation antihistaminics? As you know, that first generation antihistaminic crosses the blood-brain barrier. They are more prone for causing the CNS related side effects. Like it can cause sedation, it diminishes the alertness, diminishes the concentration of, as well as the focus, it produces lightheadedness, and since it causes all these effects, we should be very careful when we are driving because it leads to motor incoordination as well as it leads to fatigue. Tendency to fall asleep will be more, so that's why you should not involve in any activity which involves constant focus or the concentration. So basically it impairs the psychomotor performance, and a very cautious thing has to be there whenever the patient is operating vehicles or machinery. So it produces synergistic effect when it is taken along with the alcohol. If a patient with a alcoholic patient consumes the first generation antihistaminic drug, they are prone for synergistic effect, that is CNS effects will be more, and also the same synergistic effect will be seen with other CNS depressants also when combined with the first generation antihistaminics. And apart from that, the patient will also experience some of the restlessness, nervousness, and few will be facing consequences such as unable to sleep. And first generation antihistaminics are not advisable in case of children as it is going to interfere with the learning process. So apart from that, the first generation antihistaminics, they are more prone to have anti cholinergic property. Apart from CNS side effect, this first generation antihistaminic also possess the anticholinergic side effects like dryness of mouth, altered bowel movement. It can cause urinary hesitancy, blurring of vision, etc. And in case of pregnancy, so it has caused some teratogenic effects in animals, but no excess human malformation has been evident. So that's why we should be very cautious while using in pregnancy. So especially which are the drugs we should be very cautious, which has caused teratogenic effects in the animal. It is hydroxine, cyclizine, and fexofenadine. So please remember, so when compared to the first generation antihistaminic, the second generation antihistaminic do not cross the blood-brain barrier. That's why they are largely free from the CNS related side effects. So sedation will be less or sedation will not be there with the second generation antihistaminics. So coming to the overdose, what will happen in case of acute overdose of the antihistaminic? It can lead to central excitation, tremors, hallucination. There can be incoordination with the muscular activity. It will lead to convulsion, and because of the vasodilation can produce hypotension and flushing. It can increase the temperature, and it will produce the features similar to that of the belladonna poisoning. And here, in case of overdose, the death is due to the respiratory failure as well as the cardiovascular failure. So, this is about the side effects and the what are the consequences of the acute overdose with respect to the antihistaminics. And also, you have seen the difference between the first generation antihistaminics and second generation antihistaminic. So, basically, the first generation antihistaminics will going to cross blood-brain barrier, so that's why they are more prone for CNS related side effects, therefore the sedation. Whereas in case of second generation antihistaminic, they are not crossing the blood-brain barrier. That's why they are devoid of sedation. So this is the overall view of the mind map of the side effects of antihistaminics. So we learned about side effects, and next we learned about the CNS effects, and next we learned about the anticholinergic property which possessed by the first generation antihistaminic. This is not seen with the second generation antihistaminics. And the other effects which can be seen with first generation antihistaminics are epigastric distress, headache, as well as contact dermatitis when applied locally. Pregnancy we saw, and second generation antihistaminic, they are largely free of CNS side effects. Then the acute dosing will cause CNS side effects. That's it regarding the side effects of antihistaminics. So if you find this video useful, please do subscribe to I Love Pharmacology for more updates on pharmacology. Thank you.